Hi, my name is Dr. Jill and welcome to the Georgia Sea Turtle Center. This is our treatment room and this is Polly. Polly is a juvenile green sea turtle who came to us in a debilitated state. Many secondary infections can happen as a result of being debilitated. They can also get shell wounds secondary from barnacle overgrowth. So Polly's just going to get looked at really quickly. She had a little wound on top of her head that we sutured up over the weekend that looks like it's healing great. And then a lot of these debilitated sea turtles will need fluid therapy to kind of help bolster them because they've kind of been floating on the surface, not eating well for several weeks, sometimes months before they come to us. So we do a lot of additional diagnostics as well for these patients, including CT. One of the most important things we can do when they have secondary pneumonia is to use an endoscope to kind of look down in their lungs, especially if they're not responding to typical antibiotic therapy. And with the really nice camera equipment, it's not something that will either fit or react well to being autoclaved due to the high pressure and the high temperature. So you can actually damage your equipment that way. So a gas sterilizer is really important for us, particularly for our scope equipment, but then also for our transmitter surgery. So in our conservation department, we are doing a diamondback rattlesnake study, and there is a unique population here on the island. So they are tracking them and they will put internal transmitters into them. Because it is a surgery that we're doing, they do have to be sterilized, and it is essentially a radio frequency that we're picking up. So the equipment will get damaged in our typical autoclave because of the heat and the pressure, but a gas sterilizer is what allows us to kind of get that expensive equipment into the snakes and then continue our research as well to see what they're doing, what they're moving about.